To begin our presentation today, I would like to introduce Associate Professor Philip Beale. He is a medical oncologist, the Clinical Director of Cancer Services at the Sydney Local Health District for New South Wales Health. And more importantly for us, in April 2018, Professor Beale became the chair of ANZCOG. Here to open proceedings, please welcome Associate Professor Philip Beale.
Okay, well, thank you very much, Karen, for that introduction. Yes, it is a great honour and a privilege to be the chair of ANZCOG, and it's a role that I think that I really want to commit myself to completely, and we've just completed our annual scientific meeting, which has been a fantastic 3.5 days of work done by so many people, clinicians, researchers, advocates, everyone who's involved with the treatment of gynecological cancers. And I think the ideas that have come out of that with the view to the future and better treatments, I think has been really inspirational, and certainly I've been really, really happy with that. So I'm just going to run through a few things about our organisation just to set the scene before we go on to the talks. And so I think, as Karen has said, we are now into our 19th year. And we do have now 935, actually it's gone up after this meeting. We're now pretty close to 960 members of our organisation. I think importantly is that research has been conducted now in 52 hospitals across Australia and New Zealand, so it really is the extent of the reach of our research, which is, I think, really important. It's not just in one or two places, it's everywhere across the countries. And I think that this understanding about clinical trials is that really it is the best way that we can introduce new therapies into clinical practice. And I think that we know that the way that we can improve survivals is really only on the back of these clinical trials, because it forms the basis of what we can use as our evidence. It is actually the way we get treatments funded by government, and it is the way that then we can truly make a difference in terms of survival. So just briefly, these are the types of trials that we are involved with, and they are different, and I think it's quite hard to sometimes keep or understand all of those differences. So that first dot point there, the treatment trials, it really is, it starts with the earliest way that we are finding out about the safety of a treatment. We're understanding who it can actually benefit, and then we go on to compare it with other treatments that may be available currently. And so it really does a way that we then go from what we know to how we increase that knowledge to improve our treatments. Prevention trials and the early detection trials, I think, is really what we're really trying to do there is two things. We're trying to both obviously prevent the disease by mechanisms which may be about prevention strategies, which can include surgery, can include medications, and can include lifestyle measures, and it's trying to work out the best pathway for those. And the early detection ones, I think, was one that we're all very, very aware of and keen to know whether or not we really can find that early blood test, urine test, other tests which will be able to really detect cancers at the earliest possible stage where we really can then make the biggest impact. I think the diagnostic trials is sort of an area where we are doing more and more work in now, trying to understand both tests that we can do to help us to understand more of the nature of cancers, so that we can be smarter and smarter, understanding that each cancer may be a bit different, and how we can then use that information to guide therapy for individual patients. And I think very importantly is the quality of life studies which we are doing, so that we be sure that whatever we're doing, whether it be treatment, be surgery, whether it be radiotherapy, whether it be chemotherapy, hormonal therapy, targeted therapy, immunotherapy, lots of therapies, that we just always be sure that we're always asking patients about how they are feeling, what are the experiences they have, so that we do know that we are always balancing those needs against every other aspect of their care. So how do we do it here within our organisation? So we have a series of committees where we have an ovarian committee, an endometrial committee, a cervix cancer committee, and so they are the starting place where we have the ideas that will be actually discussed about new ideas and trials. That then sort of filters down to a protocol that says, okay, we are now asking a question of how we're going to decide how we can answer that question. It then goes to our research advisory committee, who then look at the science of it, look at the numbers, and understand that we are asking exactly the right question. So it's then reviewed. We then have to make sure that we can actually do that logistically across Australia and New Zealand, and then we ask all of those sites. Then we finally have a protocol which has to be written and completed. It then has to go to those hospitals and those sites, and it has to be then approved by the ethics committees and their governance committees, and then it can start. So it's a long process. It's a long process, and there's lots of little barriers in there. And I haven't said them all, just by the way. And of course, there is actually, issues which include funding. So the decision about that suitability is made in two ways. Of women's suitability would be, first of all, when we're deciding that trial, we will be deciding on certain aspects of the nature of the cancer and the nature of the patient to decide whether or not that trial is the right one for that patient. But then the treating clinicians who are involved with the care of individual patients will also be in that discussion, is to say that these are trials that are available and these are open to you in that situation. And so it's a discussion about that, because the doctor, your treating doctor, will have knowledge about your particular situation, which will be very helpful in determining suitability. In terms of the benefits involved in clinical trials, I think some of them are very self-evident. We know that several things, that clinical trials do give us opportunities for access to new therapies, and we do think that that's really, really important. We don't always know about every therapy and how well it works, so there are always challenges. But we also know that from lots of evidence that says that those people who are involved in clinical trials, on average, do better than those who are not. It just seems that the nature of those trials, the nature of the care, is that the data supports that the survival rates are better. So the challenges to clinical trials are many, I think, and I've highlighted some of them, that there are lots of issues, that just getting a trial open is hard work. There is expense in that in terms of all of those steps. There are costs. And then when you're running those trials, you have to have people on the ground to actually help and assist that. And so there really are a multitude of challenges. So just a couple of more slides. This is one of the ways we are trying to get to our trials in a faster way. And we've actually formed this alliance called the Ovarian Cancer Alliance for Signal-Seeking Studies, or OASIS, and that is really a way which we are saying, we've got these ideas, we've got new targets, we've got new ways of thinking about it, we want to actually do those trials, we want to do them quickly, and we've got some funding that we can actually then allocate to those trials. And so that's been a really huge initiative over the last few years, and we've got a number of trials that have actually started on the back of that. We're also doing what I mentioned there about trying to understand the biology and the nature of the cells and doing those work. That's the translational, that's Transgog. And again, we've allocated some resources to that so we can more reliably collect tissue samples, and we know how to actually test them to actually guide us in trials and treatment. And our fund for new research is now looking at ways we can fund work in the laboratory to help guide us to those new trials. And then when we've got that idea and we're starting out, that we can actually put in some seed funding to do that. So these are all the ways that we have been working tirelessly to get to the way to open more trials. That's it. So I will leave you to this here. I really am really excited by the program, and I do hope that you really have a great forum.
I'm going to get you to
Okay.